After that, they acquire the initial position. Is that right? Then they compute the final position. Then they will give orders through different pathways which muscles should be moved and activated, right? With which speed and with which degree of contraction so that movement can be executed. Of course, when information is coming down, it is coming down through descending tracts. Is that right? Another important thing which I want to tell you, that when you are making any movement, usually you need some background posture, right? And background tone in some other muscles also. For example, if I ask him that kick the football, make a kick movement. Actually, mentally he just moved this area. But actually, if he concentrate, the tone in hip area and spine area, that also changed. It means you were concentrating only to move your leg. But actually central nervous system computed the whole system and it knew the tension in the hip and in the spine should also be, muscles of the spine should be changed so that this movement can be properly executed. Is that right? Another example, if you are writing, try to write something. Yes. Try to write something, anything. Now when you are writing, is that right? Give her a pencil so that she really experiences this thing. Right? Try to write something, write your name or something. When you are doing it, actually you are moving only hand, but be concentrate. Tension here also changes, here also changes. Do it again. Is that right? Because this area and this area is trying to stabilize the hand. So this was voluntary movement, but automatically background adjustments are made. You are getting it? It means there have to be one descending system or multiple systems. There have to be multiple systems. Is that right? So before I go into that, I will continue discussion here first. Right? You have taken my markers? Naughty boy? No, they are here. Okay. Now listen. Premotor area plans the movement. What it is doing? It is planning the movement. Is that right? And this plan the movement of the limbs. Is that right? It plans the movement of the limbs and other fine movements like when you talk, right? Or when you are doing phonations. Supplementary motor area is concerned with very primitive movements. That is also making motor program, but premotor programming is different and supplementary motor area programming is different. Supplementary motor area plans very primitive movement. What are the primitive movement? When human beings were not writing and going for step one, when they were living in jungles, cavemen, or even more lower animal. What were the most primitive movement? Look at the lower animal, the trunk. Later on you developed the advanced limbs and then you took 4 limbs off so that you can walk on 2 limbs and do extra things with the upper limbs. But actually, initial movements were these movements and hip movements. This is the most primitive movement. These are basically planned in where? Supplementary motor area. And usually they are planned bilateral. When you stimulate supplementary motor area, some axial muscles move and they bilaterally move. Is that right? Or hips move, bilaterally move. And you know what are the primitive movements of the hips, right? You can initiate them by stimulating here. Is that right? These are relatively more advanced movements planning here. But actually, whatever motor plan is programmed, their neurons are in the primary area. Let's suppose, I'm just giving an example. This neuron is stimulating the neurons which move the tongue. This descending neuron is stimulating, this is upper motor neuron and this is lower motor neuron. This neuron is stimulating a lower motor neuron which is going to move the tongue. Maybe another neuron is here and it is going to stimulate some other neuron and that will make facial expression, facial nerve. Maybe there is another neuron here and when this is stimulated, the neurons which are going to the hand, they are stimulated. Maybe there is a neuron here and when that is stimulated, you make some movement in the foot. Now look, let's suppose premotor area decide that you should show your tongue to someone. What will happen? Premotor neurons should either directly stimulate this neuron, and with that, of course, when you are showing some tongue, maybe your naughty facial expression is there, right? So facial expression movement should also be there. Is that right? Now, It means premotor neuron just planned that which neurons should be stimulated to stimulate the final pathway for the muscular movement, right? Premotor neuron does not have a direct connection with the muscles. Or do they have? They do not have. But there are millions and millions of premotor neurons having different set of programs that which neurons, for example, you want to move your foot. Then premotor neurons will stimulate this neuron to stimulate that neuron which will go down and stimulate the muscles related with the foot movement. So what is happening? What I'm trying to say, motor programs are generated into premotor area. Once those motor programs are generated, they stimulate different group of neurons in primary motor cortex. Then primary motor cortex group of the neurons will eventually come down and move the lower motor neurons which are connected with the muscles. Is that right? But this primary motor neuron cannot plan themselves what to do. They have to be orchestrated by the premotor cortex. But if there is some bilateral movement, something like that, then primary motor neurons need to be orchestrated by supplementary motor area. Let me give you a classical example. Very classical example to understand. Actually, the neurons which are present in this area, right, they are actually concerned with phonation, with articulation, with talking. Right? For example, I want to say rose is beautiful. Now when I say rose is beautiful, it's not the name of a girl, it's flower. Rose is beautiful. Rose is beautiful when I'm saying, of course I'm moving my lips, my tongue, is that right? Vocal cords and vocal cord move and produce a sound, and then sound is converted by the movement of the tongue and lips into words. Is that right? Now this coordinated movement, it means the muscles with the neurons which are connected with the lips muscles, they should be stimulated. Neurons which are connected with the tongue, they should be stimulated. Neurons which are connected with the vocal cord muscles, they should be stimulated. But who will stimulate them? Some neurons will come from the top. But who will tell them that in which sequence and which pattern they should be moving these muscles? For example, I say rose is beautiful. And also I say, what should I say? After that I forget everything once I say rose is beautiful. Okay. Yeah? And it should be gifted to a woman. Okay. Right. Thank you for helping me. Actually I forget many things now. Listen. First sentence is rose is beautiful. Second sentence is I will present it to a very beautiful lady. Right? Now both these sentences are involving the movement of the muscles of the lips, muscles of the tongue, muscles of the soft palate, muscles of larynx and pharynx. But do you think to perform the both sentences, which are different sentences, all these muscles should be stimulated in the same sequence or different sequence and different pattern? Different pattern. Rose is beautiful requires a different pattern of stimulation of these muscles, and it will be given to a beautiful lady, will require a maybe same musculature but working in a different fashion. Where the decision is made, that is not here, that is here. There is an area here, very special area here, right? This area, this has the neurons which plan that first this neuron make a decision what word you want to say. Then according to that, they stimulate neurons into primary motor area so that muscles should move in such a way a particular word should be pronounced. Am I clear? Now this is in premotor cortex, and this is an area which programs the word. Let me tell you, listen carefully. If we damage this area, still your muscles are okay. Neurons to muscles are okay. And even these neurons which are controlling the muscles, they are also fine. But their motor programmer has been lost. If you damage this area, motor programmer has been lost. Apparatus is fine, rest of the apparatus. Can you really make meaningful words? No. You may utter few things, but you are unable to synthesize the word. The classical example is a small baby. A 3-year-old baby can produce sounds, but can he produce long, beautiful sentences? No, because this area is not functional yet. You are understanding? And if 70-year-old man, he has damage into this area, is that right? Then he cannot again, he knows what he wants to say, but he cannot say. These people, let's suppose someone gets some ischemia in this area, he is unable to speak. He may but he cannot perform the word. But if later on he recovers, he again start talking, and you ask him what happened to you. He say, I don't know what's wrong with me, what was wrong with me. I knew what I wanted to say, but I couldn't get the words out of my mouth because programmer was not there. Am I clear? So central motor system should have programmer, and these two are the programmers. Is that right? After that, these are the keys. Now you understand how much there is difference in primary motor cortex and premotor cortex and supplementary motor cortex. Are you sure? Another thing. If you electrically stimulate this area, right, it may move one muscle or group of muscles. But if you stimulate electrically this area, whole pattern of movement is generated. A meaningful pattern of movement is generated. You know what is the name of this area? Especially programs how to make words. Broca's area, yes. This is the Broca's area, how it collaborate with this area of the primary motor cortex, and this area of the primary motor cortex has neurons which control larynx, pharynx, tongue, and soft palate and muscles of facial expression. So Broca's area control these so that it can orchestrate the muscles in such a way the words can be produced. Right, so this is Broca's area. Broca's area. There is another area just above it. What do you think? What is this area? This area is called frontal eye field. Frontal eye. There's no eye there. I'm just making it to so that you remember. Don't come later on and tell someone Dr. Najib told there's an eye in the middle frontal gyrus. Right? This is just to remind that this image should tell you that this area is concerned with the eye movement. For example, there is one frontal eye field on this side, one frontal eye field on this side. If you irritate this, attention please, electrically irritate this, my eyes will swing on other side, like this. And if you irritate this, my eyes will swing from other side to other side. So it means these are the electrical push buttons of the eyes. Did you get it? These are electrical push buttons for the eyes. Eyes will push away, right? And when I'm looking straight, it means both of them are working. When I suddenly look to this side, it means it is working more. And if I'm looking to this side, it means left is working more. So these are electrical push buttons. Actually, they make the plan that how eyes should be deviated and up to what degree. Is that right? To contralateral side. Another interesting thing. If you don't remember what they are doing with the eyes, do you think if someone irritates, you love to look at him or you want to look away? You look away. Same is true about frontal eye field. They are so intelligent. When you irritate them, eyes look away. Are you understanding? So for all those lesions in central nervous system which irritate frontal eye field, they make the conjugate movement of the eyes to the contralateral side. Even sometimes epileptic activity occur here. You know epilepsy? Abnormal electrical activity in the brain. If it is here, they will look away. Let's suppose there is a cancer. Let us suppose just there is cancer here starting. And cancer is producing substances and these substances are irritating it. So eyes will look away. Is that right? Because when neurons are irritated, they overperform. Now imagine, after few months, suddenly eyes look towards the tumor. Why? They swing back. The reason being, until cancer was not destroying it, just irritating it, this was hyperfunctioning and eyes were looking away. But eventually cancer grows up and destroys this area. So they have lost their function. Can they push the eye away? But other side is unbalanced. So eyes look towards. How do you remember this? It's very easy. If someone irritates you, you have to look away, but he starts destroying your things. Can you afford to look away? You look towards. Same is true about frontal eye field. And now you understand it's a part of the premotor cortex. This is just one classical example how motor programming is done there and why doctors should know what is happening there. because there are irritative lesions and there are destructive lesions, right? And you must know what really happens there. Is that right? Of course, with the eye movement, usually there is neck movement. So just an area adjacent to, what is this? Eye movement area, frontal eye field, there is another area here, and this area is concerned with, yes please, neck movement. It plans what should be the neck movement. And there is one part of the body which makes wonderful movement. I know what's coming to your mind, it's not that thing. There's one part of the body which makes wonderful movement which monkeys and lower animal cannot make that good as you do. Do you think monkeys can type as good as you do? They can make the hand gesture so fine and artistic as you can do. They can make whole body and limb gestures, but not the fingers gesture as you have seen in Indian dances, classical Indian dances. The whole dance is about two fingers moving like this. Is that right? Or you can eat with kuchara, with spoon, without throwing the things on the whole table. But if you ask a monkey to eat with the kuchara, I think you have to clean the room total. What's the difference? Central nervous system is a very powerful motor programmer for the muscles of the hand, right? For skilled movement of the hand. And that is, yes, that is here above it. This area, when you electrically stimulate, hands start making certain meaningful movements. Is that right? Now this area is for skilled hand movements. What is this? For the skilled hand movements. And if it is destroyed, the muscles of the hand will be perfectly okay. The nerves coming to hand are perfectly okay. Even these fibers going to the hand are also okay. But you cannot make the skilled movement. The best example is small children. You know, babies can make skilled movement or only reflex movement? What is their most common reflex hand movement of a baby? You put anything in the grasp. They want to grab anything. Is that right? But then we grow up, we become intelligent, we still want to grab everything, but we don't let the other people know. We keep the hand clean and straight. Is that right? But babies don't know. So, but skilled movement, can baby write a letter to his mom or someone? No. Can baby play piano, 3-year-old baby? But of course baby has a hand and muscles. Do you think baby can do typing? Right? Why? Because in the babies, this area is not so well developed, and even this descending system is not so well developed. Are you understanding me? Right? So, this is the area which is concerned with the skilled hand movement. If some tumor or some infection destroy this area, of course, hand will be still there. Hand muscles will be there. Brachial plexus branches coming here will be okay. Even these will be fine. Person will have some movement of the hand, but not the very fine and refined and skilled and voluntary movement. Are you understanding? Because motor programmer is lost. So I hope I've made it clear to your mind that what is the difference in function of premotor, what is the special function of premotor cortex, and how premotor cortex work in collaboration with the primary motor cortex. Is that right? And what is the function of supplementary motor area? Again, let me repeat it. Supplementary motor area has a primitive bilateral movement. That is why if you stimulate this, axial movement will start. Axial movement in the central axis of the body. And if you really stimulate too much, you know what kinds of movement will start? There are two kinds of movement. One I will not show you. It is being recorded. Other movement I will show, that person will do like this. What he is doing? He is climbing on a tree. You know, even primitive motor plans are there when we were in the jungle. There are still motor programs are buried there. We are not using that much. Some people use it to climb some pipe for certain purposes. Is that right? And go up and then something happened to your budget. But I'm talking about that supplementary motor area is for primitive movement, axial musculature movement, and even some other muscles move, but they bilaterally move. Is that right? And premotor area for refined movement and programming, and primary motor area actually cannot program a movement, but if you directly stimulate it electrically, some group of muscles may move, but there is no purposeful result. For example, you stimulate this area and I do like this. Does it mean anything? Nothing. But if you stimulate here, I may do like this. Does it make anything? Yes. So it means it had a full program for a certain purpose. Am I clear to you people? Let's have a break.